present to the House on cancer awareness, prostate cancer awareness, actually. I'm going to start my presentation by describing to us what the prostate gland is actually all about. Prostate gland is a walnut-sized gland that is part of the male reproductive system. And like most of us we know, prostate cancer is a disease that is majorly affects the men. It's not a female, related disease. So, which is why I want to let us know a little about what the prostate gland is all about. So it's located just below the bladder, and it surrounds the urethra. And here I have a picture showing to us where the prostate gland is. This is the prostate gland in a gray color, and down here we have the urethra that passed right from the below of the prostate gland, to the exterior of the penis. Then we have the bladder just above the prostate gland, and the rectum just behind it. So because of the location of the prostate gland, it's why many people that have problems with either prostate enlargement or cancer of the prostate have trouble urinating, because once this gland is swollen, once it's enlarged, it presses on the urethra, so it doesn't allow adequate flow of urine from the bladder to the exterior. So the person starts having trouble with micturition. So to the next slide, I have a clearer picture of the prostate gland. This is the bladder up, and this is the urethra that it actually passes through the tissues of the prostate gland. And this right and left are the prostate gland. So what does the prostate gland do? It helps in the production of seminal fluid, the fluid and nutrients that sperm needs to survive. It produces the fluid that suspends sperm cells, which helps in the process of ejaculation. Then it's also, as a muscle, it helps in evacuation of sperm during ejaculation. The muscle contracts, and that allows sperm to flow from the site of production to wherever it's expected to discharge into. Then it helps in control of urine flow as the process surrounds the urethra. Like I mentioned earlier, it allows for normal flow of urine through the urethra. So once the prostate gland is enlarged, it constricts the neck of the bladder, and then there's a problem of micturition. And all these are according to the Prostate Cancer Foundation of Canada. Then to the next slide, what is prostate cancer itself? Prostate cancer is a tumor or development of tumor of the prostate gland. It's a disease in which cancer cells, these malignant cells, are formed in the tissues of the gland. There are two types of cells that are referred to as tumor. Some are malignant, some are benign. When it's benign, it means they are still localized. They don't have that capacity of metastasizing. But when it's malignant, It means they are made of cells that are cancerous. So that is when we can call that particular tissue a cancer cell or a cancerous tissue or malignant tissue. Now, the tumor, it consists of cells that grow into nearby tissue and destroy it. Tumor cells also spread, like I said, they metastasize to other parts of the body. So in prostate cancer, there's possibility of the prostate cells or the cancerous cells to actually migrate outside the prostate gland. They go from the source to, surrounding tissues that are, neighboring tissues of the prostate gland. Oh, sorry, I think I've made an error there. Okay. The next slide talks about incidence and mortality rates of the prostate cancer. So we have incidence, which states the total number of cases of cancer we have in Canada. So according to the Cancer Society of Canada, there's 25,900 Canadian men is said to be diagnosed with prostate cancer in the year 2023. And this 25,900 forms 21% of the total number of cancer cases that is expected to be recorded this year. In terms of mortality, this is the number of deaths that are as a result of uh, cancer. 4,900 Canadian men is expected to die of prostate cancer, and this makes 10% of all the deaths uh, caused by cancer in men in 2023. The next slide talks about risk factors. That is, what are those things that can predispose an individual to having prostate cancer? I categorize them into two. We have the non-modifiable risk and the modifiable risk. The non-modifiable risks are age, race, and genetics. I have a footnote here where I describe some of these things. Age. Under age, we have it said that prostate cancer majorly, is a disease of aging. There is an increased risk of prostate cancer when man gets older. So it means that the older you get, the more at risk you are as a man to developing prostate cancer. Then second factor is race. It is according to research, it's been stated that African men are they have twice chance of developing prostate cancer than the white American men. And the white American men also have higher chance of developing prostate cancer than the Asian men. Then in terms of genetics, if this talks about hereditary, right? It means cancer is generally hereditary. So research have established that if a father, brother, or multiple blood relatives have had prostate cancer as an individual of the same family, one is also highly prone to developing prostate cancer. Then continuation, there are the modifiable risk now. We talk about cigarette smoking, we talk about obesity, we talk about diets. Um, okay, one second. Trying to okay. So men in Western countries have much higher rates of prostate cancer than men in Asia, like I mentioned earlier, while no one can definitely, definitively explain the phenomenon, the reason why this is so. But research have established that or suspected that differences in this region, I mean, in the occurrence of prostate cancer in men from this region is based on what they eat. Like we all know, the people from Asia, they eat more of vegetables and all that, while here in North America, we eat more of processed food. So this account for the possible differences in, occurrence and incidence of prostate cancer in both region. And diet, they said eating habits and diet that heavily rely on fat and animal proteins can cause DNA damage and lead to cancer. So basically, when we eat too much of fat, trans fats, unsaturated fat, and these are predisposing factors, that cause predispose one to development of cancer. And what it does is it interferes with the body tissue chemistry. It interferes with the DNA of our body cells, and result in malformation or dysformation of our body cells, leading to cancer. So the next slide will talk about prevention. What are those things we can do to prevent, or in any case, if one is at high risk of developing it, at least delay the development, to probably later part of one's life. So one, I'll talk about quitting cigarette smoking. This can improve one's health in many ways, including lowering your cancer risk, as smoking predisposes one to prostate cancer. Under my note here, I mentioned here that prevention might be difficult if you have these risk factors. That is, somebody that has those non-modifiable risk. Someone might be, might have one of those, but like people like us, Black men, we have established that in Black Americans, there is high risk of prostate cancer. Now, you are Black American, or you are Black Canadian, or an African man, and there is this hereditary trait of having developing prostate cancer, then that means you have had like 65% chance of developing prostate cancer. Now, if you had all these modifiable factors to it makes you more prone to developing prostate cancer. So that is why the statement mentioned that it's difficult to, prevent prostate cancer in people that have higher risk of developing it. Early screening, excuse me. Early screening, however, often can help ensure that if you do get that cancer, it is diagnosed and treated as soon as possible. Cigarettes may impact the risk of developing prostate cancer and eventually, leading to death. Maintaining healthy weight is another modifiable prevention. When you engage in weight control, this helps in maintaining healthy weight as you get help to reduce the risk of cancer and many other health problems. Now, maintaining healthy weight does not only help in reducing cancer, it also helps in preventing some cardiovascular disorders. Somebody that have history of heart failure in the family, cardiac disorders, hypertension, cardiac failure, and all sorts. There's something we call angina pectoris when there is pain, striking pain in the chest. So when you try as much as possible to cut down your weight, it helps to prevent all these problems. Not only development of prostate CA. Now, another thing that can also be done is when you stay sexually active. Studies have shown that men with higher frequency of ejaculation, with or without a sexual partner, were up to two-thirds less likely to be diagnosed with prostate cancer. There's an explanation down here that says, yes, the study is said to still be ongoing, but research have theorized that frequent ejaculation clears the body of toxins and other substances that could cause inflammation. This is according to Job Hopkins Medicine of 2023. Regular exercise, the regular exercise, combined with weight and, staying sexually active, both men and women. All these it's not only effective or only useful to men alone. It's actually useful to virtually every human being. By the time you engage in two or three of these things, you personally feel the effect in your body. So it's highly advisable to engage in all these activities. Now I that will lead me to yes, the next, sorry, I think yes, next slide, which is continuation of the uh prevention of prostate CA. So I have here reduction of fat intake. Healthy fat intake, such as omega-3 fatty acid that are derived from nuts, seeds, and fish are essential. And avoidance of trans fat and saturated fat, you know, are also helpful in preventing uh, development of prostate CA. When you eat more of fruits and vegetables, it's also helpful. Like I earlier mentioned, research have shown that men from the Asian continent, they have less, documented cases of prostate CA than men from the American continent. So when you eat leafy green and cruciferous vegetables, examples broccoli and cauliflower, these contain a compound called sulforaphane that may protect against cancer. Green tea and soy is another thing that we can engage in, eating. Um, Clinical trials have suggested that soy may lower PSA level, and that green tea may help high-risk men lower their prostate cancer risk. Avoid charred meats. Charred meat is the meat that you keep on, you fry with high temperature when you leave your food on the heat for forever. So they tend to produce a chemical that leads to, cancer, because at the end of the day, the good nutrients that are good to the body are already destroyed by the heat. So by consumption of that will predispose one to development of cancer. And these are studies that have basis from John Hopkins medicine. So the next slide will talk about signs and symptoms of prostate CA. When an individual begins to have in urination, difficulty in urination. Now, I like to state before I go further that All these symptoms, they are not particularly peculiar to prostate CA. Prostate symptoms of prostate CA, they mimic symptoms from other diseases or other troubles of the body. Because, for example, difficulty starting to urinate does not only uh, follow development of prostate CA. We have seen this in cases of sexually transmitted diseases, cases like benign prostate hypertrophy or benign prostate hyperplasia, urinary retention, and so on and so forth. So all these symptoms that I listed here, they are just like contributory. There are symptoms from contributory disorders of the body. But if any of these, anyways, let's go for the. I'll mention that later. So we have difficulty, starting to urinate as one of the symptoms of prostate CA when there is weak or interrupted flow of urine. Naturally, a man should be able to, if a man is peeing or urinating, he should be able to project. So by the time an individual is unable to project, that is when weakness in the flow of urine begins to come in, or when you begin to urinate and intermittently stop along the line with involuntarily. Those are possible signs of development of CA. Now, urinating often, we call this frequency, and urinating at night, nocturnal micturition. So all these are signs of prostate CA, but not, like I said, not majorly prostate CA, symptoms. Trouble emptying the bladder completely. This happens when you go to the bathroom, you want to pee and you pee, but you're unable to go further. Yet you feel that something is still there in your bladder. So there is always some residual volume at the end of your maturation. So this is also a sign of prostate CA. Pain or burning sensation during maturation. Like I said, this is also another symptom that could be related to any other thing. Sexually transmitted diseases like gonorrhea, syphilis, and all that. So they're not, generally peculiar to development of prostate CA. Other symptoms include presence of blood in the urine or presence of blood in semen. Then pain in the back, continuous pain in the back, hip, or pelvis that does not go away, even despite you have taken analgesics, regardless of the type of analgesics you take. Then painful ejaculation. If you look at all these symptoms, they are closely related to other symptoms from other diseases, and that is why we have mentioned earlier that prevention and identification of prostate CA is not so clear, and we just have to be vigilant, and that if one begins to have one, two, or more of these symptoms, the best to do is to visit your doctor. So I think there is something that I missed earlier. It's about uh age. The incidence of prostate CA is high between the age of 50 and 60. And this is the age at which is uh, advisable to go for screening, actually, at least once in a year. But I will further, I'll mention that, I'll treat that later as we go on in this discussion. So screening for prostate CA, early detection and screening is the next thing to discuss about. Yeah, there are two tests that are available to detect prostate cancer early. It's just like the breast cancer that women are advised to always engage in self-breast examination. But unfortunately, we cannot do, as men, we cannot do self rectal examination because it's not something that is easy to do, on your own. But it's advisable that by the time one begin to have one or two of the mentioned symptoms, and you feel you have treated it and it still persists, the best is to pay a visit to your healthcare provider. So if you and your healthcare provider decide that the test is right for you, you must have both of them, that is, you must, undergo the two tests that are said to be available and not just one. So one of it is digital rectal examination. This is a physical examination of the prostate that you do through the rectum. The healthcare provider inserts one gloved finger into the rectum to feel the prostate for lump or anything else that seems unusual. This will help to detect irregular shape or size of the prostate gland, which is indicative of possible CA. Generally, the one thing that we use to determine whether a tissue is cancerous or not is the shape. A cancerous tissue is always irregular. By the time you palpate such tissue, you feel unevenness in the tissue. It's meant to any part of the body, any part other except if there is lump or anything. Even if there is lump, the lump is expected to be even if it's gonna be a benign lump. But by the time it becomes uneven, it becomes irregular, it becomes movable, then you begin to suspect, okay, could this be cancer? Could this be something else? So digital rectal examination is one thing that is actually the easiest to access. The easiest to access in identifying whether one may be having prostate CA or not. Now, the second test is called PSA. We call it PSA. The meaning is prostate specific antigen. This is a blood test that measures the PSA. So you have to, blood sample have to be taken, and a substance, blood sample have to be taken to the lab, and they will, they will assess it and uh, tell us, they will look for PSA in the blood. So PSA is said to be a substance that is produced by the prostate gland. So usually the normal level of PSA changes as one grows older. And this is the reason why it's advisable to do the two tests together, not just one. You cannot use the digital rectal examination only to determine whether you're having prostate CA or not. And at the same time, you cannot do PSA only to determine whether you have prostate CA or not. Because, like I said, the normal level of PSA increases with age. Or aside from prostate CA, there are some other conditions of the prostate gland or the body that can result in increased PSA. So I added the notes here that um, different prostate problem can cause higher level of PSA. For example, if one has benign prostate hypertrophy or benign prostate hyperplasia, this is just an abnormal swelling of the prostate gland. This will at the same time increase the amount of hormone that is being secreted by the prostate gland. So therefore, we cannot use that to determine whether an individual is having a prostate cancer or not. Sometimes people with prostate cancer have PSA level that are not even higher than normal. Sometimes your PSA level could be within normal rates. It just indicates that there might be a problem with the prostate. That is, the variance in the volume of, the amount of PSA that is read will only indicate that there might be a problem. And with that, you and your healthcare provider will have to engage in a further discussion. Treatment of prostate CA is not like I want to treat malaria or I want to treat diabetes. It requires a long-term deliberation before you go into it. The next slide will talk about screening in Ontario. Although usually the same type of investigation that we do in Ontario, the same that is done everywhere in the world. But in Ontario, like we have or let me say in Canada generally, we have single what's it called now? Like single care, or these are our whole medical care system is quite different from what they operate in the United States. United States uses Medicaid and personal insurance, but here in Canada we use a single pay system. So our single pay system covers PSA text if you have OIP card. Now, regardless whether you have OIP card or not, if you have OIP card and you go to the lab, you want to do PSA, they will not do it for you. There is a standing rule by the Ontario Cancer Society. They will not do it for you. They will only do it if a physician and a nurse practitioner suspect that prostate cancer, they suspect that the individual is having possibility of having prostate cancer. Then they refer the fellow for testing. So without referral, Life Lab or wherever lab will not take sample for prostate for PSA. Then OHIP will also pay for your card only if you have been diagnosed with prostate cancer and you are receiving treatment. So an individual that is going to the lab for the first time without a referral from your family physician, without a referral from your nurse practitioner or any other person, will not be attended to, even if you have OHIP. Then if you have not been undergoing treatment for prostate CA, they will not do the test for you. And then if you are not being monitored, probably after treatment, PCA is not going to be accessible to you. You will have to pay for your PCA out of pocket, only if you do not have if you don't belong to any of the three that I mentioned earlier. But usually, even if you decide to pay from out of pocket, there are still some other things that have to be considered. One of it is your age. If you are not within that range of age where prostate CA development is rampant, you may be denied. Then it is not done or based on whatever the individual presents with, in an individual that has 10 to 15 years of life expectancy, they will not do PCA for such person. Then an individual that is, older, above 70 years old, they will not do PCA for such fellow. Reason because they said, yeah, the Canadian Task Force on Preventive Healthcare recommend against screening for prostate cancer with the PCA test for men of all ages. Naturally, for men of all ages, they don't want you to do PCA. However, the greatest benefit from screening appears to be in men aged 55 to 69. So meaning that someone that is less than 55, except if the person has been presenting with persistent symptoms on unresolving symptoms of prostate CA, they will not do PCA for such fellow. Then when the person is beyond, above the age of 69, no PCA for the person. And these are the set of people that are categorized under having to live 10 to 15 years life expectancy. Okay, so yeah, okay. Now I'll go to treatment. If prostate CA is early detected early, treatment is often successful. That is early, between that age range, between the age of 45, 50 to 69. Treatment is often successful. If you need treatment, your doctor will discuss the options with you. Prostate CA treatment can seriously affect one's quality of life. And this is the reason why in the previous slide, the reason why the uh, Canadian Task Force on Preventive Health are kicking against having everybody to have access to, being treated. Being tested for PSA. So they said prostate CA treatment can seriously affect one's quality of life. Because the treatment cause side effects such as erectile dysfunction, problems getting or keeping an erection on, and incontinence, loss of bladder control. Usually, these are possible complications after surgery. Then there is localized prostate cancer, which can be treated with active surveillance, surgery, radiation therapy, and hormone therapy. This is a type of prostate CA that refuses to grow. Fine, the prostate CA, the cancer is there, but it's not benign. It's not malignant. So this last line of number 4 point refers to those type of benign prostate CA. That is those that do not metastasize to other parts of the body. Treatment options for very low and low risk localized prostate cancer include active surveillance. That is, they will continue to monitor the patient. Watchful waiting. Your healthcare provider wants you to just hold your peace. Don't provoke the cells, right? Yeah, don't provoke the cells. Just be watchful, right? Then the next line of action will be surgery. That is if It's saying that the cancer cells are growing, and they have grown to that level where it is felt safe to remove. Because if we rush into the treatment, if we rush to do surgery, or if we rush to commence radiation therapy, we may damage normal body cells. And that is why they want us to, keep our peace, hold on until it is determined that the cells are fully grown and they are safe to remove. If we go early, there is possibility of not removing the whole cancer cells. So usually there is always a reoccurrence. There's always a relapse. But when you wait for the cells to develop to that matured age, then you are sure that if you go in for surgery, there is possibility of being able to, extract every cancerous cells that are in that region. And if you decide to go for or to opt for radiation therapy, if cancer cells are not well developed, radiation at the same time as the way they are good to treat cancer cells, they are at the same time dangerous because they destroy normal cells of the body. So that is why it's advisable that you don't rush into it. First thing you do is, keep watch of it, maintain surveillance, go for your appointment as I went you, then be watchful watch your symptoms, see if they are getting worse or not. If they are not getting worse, do your life, do your thing, the preventive measures that you are supposed to, that you can do, go ahead and do them. If you want to use your diet, if you want to use exercise, any other thing that you feel you can use, you go ahead and do that. And eventually, uh, you may be, lucky to keep it the way it is, especially when one is, tending towards the that last uh, part of life, 60 years and above. You don't need to stress yourself and that much. But for someone that is probably between the age of 50, less than 69 or less than 65, then that is where active or when active treatment is actually sorted. So it's advisable to follow all these guidelines. And available resources in Ontario, there are a number of organizations that are uh, you know particular about the care of cancer patients or people living with cancer in Ontario. One of it is cancer service locations. So all these they can be googled, and they are easily accessible online. Then you find cancer service locations and contact information. One of it is regional cancer centers. I think they are in different regions in the province. And then there's this Sakuma services. They are also accessible. I mean, their information is online. Stem cell transplant centers, diagnostic assessment program locations. So they are easily accessible. This is below here is a website where one can have access to them. There is also home care service for people living with cancer. So home care is arranged through community care access centers. We have there's an organization in Ottawa here. We call them Lean. I think they've changed their name to community whatever. I can't remember the name. It- so they are in charge of getting uh healthcare providers, attaching healthcare providers to clients to be able to access healthcare services. You can speak to your healthcare team about getting home care if you think there's need for it. So basically, the treatment of cancer by prostate CA is like treatment of any other medical ailment in Ontario. It's accessible in our hospitals as long as you have a referral from your primary physician or nurse practitioner, as long as um, you are deemed fit to benefit from screening and benefit from the treatment, then all these are accessible to anybody that resides in Ontario. And if we are considering the non-residents, so to say, well, there's no resources out there that takes care of non-residents. I mean, non-residents or temporary residents per se in the treatment of prostate CA. But I believe anybody that have healthcare insurance would be able to access treatment for prostate CA in
Okay.
Ontario. Yeah.
Okay. Thank you so much, sir.
You're welcome.
We'll just go straight into the questions now. While you were talking, we had people send in questions in the chat group. Yeah, so you were saying a diet that is heavy on animal protein. So I'm saying, someone asked, so for those of us who are Africans, Nigerians that like our meat, does it mean that we'll have to reduce our meat? And then somebody else said, we eat pomo a lot, and pomo is healthy. And besides that, most of the foods we eat in Africa are more organic versus what people eat here. So how does that part of diet affect us as Africans? And then you also spoke about charred meat. So we're like, is grilled meat part of charred meat? Somebody was asking for the frequency specification. I'm sure that was in relation to the fact that you said people who ejaculate often have the issues of having prostate.
Okay, let me take it one by one. Yeah. I'll start with is it frequency of maturation the person is talking about now, or
Ejaculation.
Well, studies have shown that when you ejaculate, it helps to reduce toxins build up in the body. So it doesn't matter number of how many times you ejaculate in the day. It is not related to anything. Okay, but what is important is to make sure that at least, I mean, not that they are not saying we should make it a daily meal, but if you have access to it, yeah, it's helpful. If you are sexually active, it's a plus. But no researcher have come to say, oh, you have to do it 5 times a day, 10 days a week, 20 times in a month. No.
Okay, so it's just being sexually active.
Just being sexually active.
Okay, so does masturbating early in life increase the frequency or reduce the risk of prostate CA?
Well, there is no relationship between developing prostate CA and masturbating early in life or later in life. What matters most is getting semen out of your body, either by by coitus or by masturbation. They did not say masturbation anyways. No
What is
researcher have come
coitus?
to say
What is
masturbation.
coitus? What is coitus?
Coitus means meeting between couple.
Okay, sexual intercourse.
Sexual intercourse, yes.
Okay.
So either by sexual intercourse or by masturbation, the point still remains that you have to be sexually active,
Okay. Does the
as this is.
surgery? Okay, another question. I'm trying to, because we are running out of time. Does the surgery include cutting off the testicles only? Someone is asking.
Surgery for prostate CA.
Mm-hmm.
Well, prostate CA surgery, there are two types of surgery they do. There is back home, we usually run away from that surgery of a thing.
Mm.
The reason is this. In those days, there is prostate is highly supplied with blood.
Mm-hmm.
And majorly, the reason why people die of after surgery, after removing prostate back in Nigeria then, is because prostate is rich in blood and they tend to bleed a lot.
Okay.
So most times, bleeding post-op is what kill people, an infection.
Okay.
Now, these days, there is something we call TOF, transurethral removal.
Mm.
They will not make any opening. Okay, they go through the urethra and do. I mean, it's more like if anybody has done an endoscopic procedure where they go in to look into your colon and see what is going on. Yeah, that is the
Like that.
same process
Mm-hmm.
that transurethral section go through. So they pass that tube, that device through the urethra, and it chop off the tissue.
Okay.
Yeah.
Okay. Can
So
prostrate
it doesn't
CA?
affect, it doesn't have anything to do with the testes or testicles. No.
Oh, okay. Nice. Can prostrate CA reoccur? Someone is asking.
Yes, it does. It
Mm-hmm.
can reoccur. And that is why I mentioned in earlier that you have to you know, one second. I want to pull out the yes, you have to be watchful and yeah. You have to be watchful and maintain active surveillance so that by the time you don't rush to go for treatment. Even though you've identified it, your physician will begin to follow up with you. They begin to monitor you. They begin to monitor your symptoms before deciding whether you are ripe enough for the procedure to remove it. So definitely it reoccurs if the whole cells are not removed. Then by the time you tamper with it, there is high risk of metastasis.
Okay.
So by the time they tamper with it and they are not able to remove everything, the discharged cells could go into the surrounding tissue and affect the surrounding tissues. And from there, they could, you know, metastasize to other parts of the body through
Okay.
blood.
One other person is asking if ejaculation helps reduce the probability of getting prostate cancer. What is the implication for men who do vasectomy for family planning?
Well, I don't think there is any relationship. The thing is, depending on the risk factors that the person is exposed to. If someone from my region, an African, goes for vasectomy and he had the possibility, we are not saying that ejaculation will totally, prevent you from not having prostate CA. No, it will only reduce your risk.
Okay.
It only reduces the risk. Not that if you do vasectomy, if you don't have, you don't, if it does not run in your family, if you don't have history of anybody having died of prostate CA in your family, that means it is not genetic to you.
Mm.
So even if you have done vasectomy, you may not, have it. But in a person that has history of prostate CA in his family, is the person is obese, right? The person is not active, he lives sedentary life. The person eats all kind of fat, all kind of meat, all kind of anything. The fellow is definitely, definitely prone to developing prostate CA. Vasectomy is just, our sexual intercourse is just one thing that could prevent you from having prostate CA. If other things are there, then the person is likely to develop prostate CA.
Okay.
Then I want to talk about the grilled meat.
Okay.
Yes, the eating grilled meat does not mean one will have prostate CA, but the point is, it says charred meat. When you cook your meat under high temperature,
Mm.
when you cook your meat under high temperature. So it doesn't matter whether it is grilled, for as long as you leave it, or you leave it in under on the grill forever, and the heat under it is not reducing. You continue to, and you eventually eat it, then there's possibility of being prone to CA.
Okay.
Yeah. Then the diet. You mentioned something about diets.
For more, yeah, somebody said for more, because you said something about our diet. So we eat a lot of pomo, and most of our foods are organic. Does it still
Yes,
matter?
organic food is good. We have access to fresh food, fresh vegetables back home. Now, the difference there is that when you eat too much of meat, when you eat too much of meat, you tend to accumulate more of saturated fat.
Okay.
Now, these are the set of people that have hyperlipidemia. That's accumulation of lipids, excessive lipids in the body. To avoid that, it's advisable that you eat more of fish, and by so doing, you are trying to reduce your lipid accumulation, but at the same time, unknowingly, you are reducing your risk of developing prostate CA as a man. So eating more vegetables, less animal protein is highly helpful in reduction of. Then there is a point that I missed out. That's you know drinking drinking of drinking of in moderacy.
Alcohol, okay.
Not alcohol now, red wine.
Okay.
Research has proven that red wine, you know, in moderacy helps in reduction of toxins.
Okay.
So thereby helps in, reducing the risk of developing prostate CA
Mm.
in moderacy.
Okay. Thank you so much, sir. We don't
Yeah.
have any more questions for now, and I think I have tried to answer, tried to, call out all the questions that are on the chat group.
Okay.
So I'm sure everybody has understood what the seminar, the workshop was about, and they understand more about prostate cancer now. So we thank you for that. Hold on. Okay. So we want to thank you for giving us of your time, and we want to thank everybody who came in who is attending this workshop. I am sure you are more knowledgeable about prostate cancer, and it has made the difference. So some of us may have not reached that age group of 55 or to 69 yet, but we have people in those age groups, so we can advocate for them and educate them, inform them about the things we know about prostate cancer. So thank you. It has been a very nice time. We went over our time, but it was worth it. So I just want to thank everybody for hanging in with us. Thank you for staying. I'm sure you were blessed by this session. So yeah, so without much ado, we'll just go out to end because we have moved way past our time. So thank you so much, Mr. Denny. Thank you everyone for coming in. God bless you and enjoy the rest of your evening.
Thank you too. Thank you for having me.
Yeah.
Have a nice evening.
Thank you. You too.
Bye, everybody.
Bye. Thank
Bye.
you so much.
Bye, everyone.
Thank you.
Bye.
Bye.
Thank you guys for having me.
Thank you for joining in. We appreciate you.
Bye, everyone. Bye, everyone.
Well done, Ivy. Thank you, everyone.
Thank you, Mohumi. Thank you so much.